from NHA, and Rashmi, who is the subject matter expert. I welcome you all on behalf of NHA today for this session on Digital Health Incentive Scheme. I'll just share my screen. So just to give you a backdrop of how Digital Health Incentive Scheme came up, it was actually launched in December last year, but it was operationalized in the month of January this year. But whosoever is registering even right now, we are giving them incentives with effect from 1st of January. Under this Digital Health Incentive Scheme, any facility can claim up to benefit of 4 crore rupees. The basic aim of starting this scheme was, number one, to enable all the stakeholders on a single digital highway and make them more compliant to the ABDM. And secondly, to motivate the stakeholders so that they can be given financial incentives. Now, under the scheme, the main stakeholders are hospitals, labs, the imaging centers, and the digital solution companies. The hospitals can earn incentive of rupees 20 per record. The labs and the imaging centers can earn incentive of rupees 15 per record, and the digital solution companies can earn up to rupees 5. Coming to the eligibility of this scheme, so every stakeholder, or I would say every entity, has got different eligible criteria. Coming to hospitals, the hospital should be having at least 10 beds, and there should be software linkage done with ABDM. Also, there should be IPD facility. There should be inpatient beds in that hospital. For a lab or a radiology center, it should be the nomenclature should be the imaging center or the diagnostic lab. Now, coming to the digital solution companies, I would like to mention here that the digital solution company can be of different types. First could be HMIS or LMIS provider. And the second category could be the lockers and the teleconsultation services. For a DSC, which is HMIS or LMIS, there should be at least 10 facilities associated with that DSC.
I think screen has been freezed. If you can confirm that they are able to view your screen.
I hope you are able to view my screen.
No, it is not moving. So, एक बार दोबारा login कर लो.
Can anyone confirm, is the screen visible now?
Yes.
Thank you. So I was mentioning about the digital solution companies. The digital solution companies, as I said, that HMIS or LMIS provider, they should be at least 10 facilities associated with that digital solution company. And if it is a locker or if it is a teleconsultation service provider, then there should be at least 2,000 transactions per month, because in that case the 10 facility clause is not applicable. Now this is actually the detailed criteria for the incentive policy. Coming to hospitals, for a hospital to be eligible, there should be 50 transactions per bed per month. For example, if there is a 10-bedded facility, then that 10-bedded facility should be doing 50 into 10, which means 500 minimum transactions. 50 here is a constant. Now, this is the capping, 500 transactions for a 10-bedded hospital. Anything over and above 500 transactions would be the eligibility for that hospital. In that case, the hospital is going to get 20 rupees per additional transaction above 500 transactions. Similarly, if we come to labs, there should be minimum 500 transactions per month. Anything done above 500 would be given 15 rupees per transaction, which means that till 500 nothing would be given. From 5 not first transaction, 15 rupees would be given. Coming to the incentives for the digital solution companies. Now, if I talk about the bigger hospitals, which I said that more than 10 beds, in that case, the corresponding digital solution company is going to get 25% of the incentive amount which has been received by the hospital. If the hospital is small, which means if it is a small nursing home or a small clinic, which is less than 10 beds, then the DSC would be given ₹5 per transactions, provided the number of transactions are more than 200 per month. Now, here is a catch in it. Unlike hospitals and labs where they were not getting anything till the base level criteria, the DSC is going to get here from the first transaction, which means if there are 200 transactions done in a small hospital, the DSC is going to get 200 into 5. The base level is set as 200, and anything extra done would be counted from the base level. Similarly, for the health locker and for the teleconsultation, the minimum base capping is 2,000 transactions in a month. Now, coming to what is transaction or the definition of transaction, it basically has two parts. First of all is the generation of the health record from the ABDM enabled software, and second is the linking of that health record with the ABA ID or the ABA address. So I would say that, for example, the patient has undergone one lab test, sugar random has been done. And that was done from the hospital where there was ABA enabled software, ABDM enabled software. Now that health record should be linked against that patient's ABA ID. Then we would call it a transaction, otherwise not. And there is again one clause here. For example, if the patient undergoes 5 lab tests in a single day, then out of those 5, only 1 would be counted as transaction. And similarly, if the patient undergoes, let's say, for example, 50 lab tests in a month, then out of those 50, only 5 would be counted as transactions per month. So in a day, maximum 1 transaction, and in a month, maximum of 50 transactions. I'm sorry, 5 transactions. Now, these are some of the documents which are required for the registration process. As I mentioned that the scheme is applicable with effect from 1st of January. Whosoever registers now, they would be getting incentives in the backdate also, starting from 1st of January. Now, there are basically 4 types of documents required here. First is the cancelled check of the entity. Second is the PAN card. The third is the bank mandate form, and the fourth is the annexure form. I'll just tell you what all are these. This is actually related to the calculation of incentives. The facilities which are QCI certified, I mean the DSCs which are QCI certified, they are going to get 20% of extra incentive once they register themselves in QCI, and the incentive is going to be applicable from the subsequent month. Any errors which are there can be reported to abdm.incentive@nha.gov.in. We have started the payment cycle into 2 parts. For anybody who claims before 5th of the calendar month, they would be eligible for the first payment cycle. For anybody who claims from 5th to 20th, they would be eligible for the second payment cycle. So this is actually how the portal, the HFR portal looks like when any facility is going to register for DHIS. So as I mentioned that the facility should be having 10 beds and there should be software linkage with the ABDM. So they are going to see something like this. There would be a tab appearing on the screen, register for digital health incentive scheme. And as they are going to click it, they are going to get the eligibility criteria, which we already discussed. Plus, these are the 4 documents which I mentioned. Bank mandate form. Bank mandate form is basically the certification from the bank. The bank writes on a piece of paper, yes, that this entity has this account holder. So they basically certify this. The cancel check. Annexure 4 is required only for those entities where name on the bank account and the actual entity name is different. So the entities, they actually certify that yes, this is our entity and this is under our name. And the PAN card. Now, as you click further on the DHIS tab, these are the fields which are going to appear on the screen. This client ID, or I would say the bridge ID, it would automatically pop up, and you have to mention here all the account details. These are the documents which we were talking, the cancel check, PAN card, and other documents like bank mandate. Bank mandate is no more mandatory because we are also trying to maximize the registrations. So for now, we have kept it as non-mandatory, but definitely for processing the claims, it would be mandatory. Now, as one submits all these forms, there is a declaration or undertaking. You just have to tick it, and there would be submission of e-sign. So again, there would be one document generated, and you have to digitally sign it. So this is how the e-sign form would look like. This is how the screen looks for a digital solution company when they register themselves for DHIS in the sandbox. So again, there is a tab, as you see on the left side, register for DHIS. The fields are almost going to be the same, which were there for a hospital also. With this, we have finished the session. We are now open for questions and answers. I would also call Vikram sir if he's available for the question answer session. So I'm just seeing the questions from the chat box.
And meanwhile, you can also raise your hands while asking questions. So we will unmute you if you will raise hand, and if you have query, we will unmute in that.
So somebody has asked, what about up to 50 transactions per bed per month?
So this is the minimum criteria, like 50 transactions per bed per month. So if it is less than that, then it is not eligible as per the current scenario of DHS. But we are improving on this scheme, and we are taking feedback from the multiple stakeholders. So if we feel that the requirement that before 50 transaction we need to pay, then we are definitely considering some policy level decisions.
Dr. Khan has asked, if it is a private clinic, what would be the amount?
So currently the amount would remain same as per the eligibility. So we have not distinguished anything between the private and government as of now, because for us as you will be a part of HFR, and the amount would be same right now for both private and government facilities. So two participants raised hand also. If we can unmute them and ask their queries. Participants. Unmute. So Mohit from eConnect, if you can ask your question.
Yeah, first of all, congratulations to the NHA team for the launching the wonderful scheme for the basically hospital and everybody to just come up and engage there. And my question is, if a hospital just grows 501, that 500 is a capping. If 501, that it will be eligible and calculating the scheme from 501 to the 20 rupees.
Yes, so basically you are asking for facility.
Yeah.
Yes, so if it crossed the minimum transaction of amount, minimum bet, so like we have shown the figure in the illustration as per the bet. So it has shown that for the 10 bet facilities, minimum 500 transactions should be there. So yes, if it is a 501, then it will be, it will got the incentives of 501 multiplied by 20.
Okay, thank you. Thank you for the question.
Yeah. So Vikash Srivastav, if you can ask your question.
Hi, sir. I'm Vikas from King George Medical University, Lucknow. Sir, at here, we have POCT as a third-party vendor for lab services. So if also he is also joined under DHIS, so we got incentive from both sides, from hospital transaction and from their POCT lab report side.
So yes, so basically in that, I think POCT vendor would work as a DSC. So for facility, there is a different criteria, they will get the incentives. But if DSC is doing transactions to that extent, then POCT will also be eligible for that transaction.
But sir, their transaction is also the part of the e-hospital, which is HMIS, which we are right now using it.
So ultimately it will go to the HMIS vendor. So I think NIC or CDEC solution will be deployed there, right?
Then POCT will not get any incentive?
No. So POCT won't get any incentive because ultimately it's the HMIS which act as a DSC in your case.
Okay. Sir, the transaction, the word transaction is for clinical notes, for lab report services related, and RIs. What is the clear definition of transaction? When you come to hospital and generate an OPD ticket, is it transaction of a patient or not?
So basically transaction, as already Sangeeta explained earlier, that it is the generation of a health record from ABDM enabled software. So suppose if even if in lab case, if we have a DSC like Lalpath Lab and SRL, and they are generating one health record, be it's diagnostic summary or be it's a prescription summary, that will be considered as a transaction in that case.
Sir, your IPD is considered as a transaction or not? When you admit in a hospital, then IPD is considered as a transaction or not?
Yes, it will be considered as a transaction because ultimately you are linking one IPD record with your ABA or ABA address, right?
So OPD records means OPD ticket is not considered as a transaction, but IPD is considered, clinical notes is considered, discharge.
No, why? No, because that's not the case. So even if it is a OPD consultation report and you are linking it with your ABA or ABA address, so it will be considered as a transaction. So basically NCRES, basically there are 7 clinical artifacts. If that is coming into that category, so suppose OP consultation record is there, immunization record is there, or prescription report is there. So if it is linking to that ABA address, it will be considered as a transaction. However, for that particular patient, if you are linking one IPD record and one OPD record on the same day,
yes, sir,
there will be 2 different records, right? But okay, on that particular day, it will be considered as a one transaction for the DSC.
No, sir. I just question just now, all hospitals generating OPD tickets. So if today if I generate 100 scan and share, if I generate 100 ABHA accounts, then I can say I can generate 100 transactions.
Yes, yes. If you can link those record to a individual ABHA or ABHA address, it will be considered as a transaction in OP consultation case also.
Okay.
Generation is not important. Basically, linking is important, because ultimately, even if I scan and share, I got one token number and I'm going to the counter and they will generate my OP slip, right? But if that OP slip will be linked to my ABHA or ABHA address, then it will be considered as a transaction also.
So when we create ABHA and generate a OPD ticket through a scan and share or through ABHA, it is already flowed towards all the modules like ADT and all that. It is already connected already. I don't think any such मुझे अलग से record link करने की जरूरत नहीं है. I don't think so.
Also, it will be considered as a ABHA link record. And even if this is the case, even if you have seen that there was rise from scan and share since last October, there is a proportional increase in the number of health link records also.
Okay.
So that will be considered as a transaction.
Okay, sir.
Anish, if you can ask a question.
Yeah, there are two questions. One is till what time is the scheme available? Because as far as we understand, it was till first quarter of this calendar year. Second, if there are multiple facilities registered, do they need separate nodal persons and bank accounts to be linked, or they all can be linked to a single bank account for incentives?
So for the first part, I think the current we have launched this scheme for initially for the 6 months. So we will see as per the financial outlay, and then we will depend on the further course. For your second part, you asked about registration. Could you repeat that part?
Yeah, we are in a state where there are multiple facilities registered with a single nodal person. So for
this registration, for DHIS registration, you need to do that one by one. So facility needs to be registered one by one.
So that means
there is no provision. So there is no provision that you can do bulk registration in DHIS.
No, facilities are registered, but do all of them need separate bank accounts, or they can be?
Yes, they need to be separate bank account. If registration is different, then they need to be different bank account.
And if registration is for the health facility ID under one nodal person?
Sorry. So moving to the questions which we have received in the chat. So we have received one question from Vijay Shri Upadhyay, which software should hospital use and how it can collaborate with ABDM. So Vijay Shri, to answer your question, we have multiple HMIS which has already been integrated with ABDM, and we have a list that list available at ABDM partners page. And currently there are multiple private HMIs as well as government HMIs which have been already integrated all the milestones with the ABDM. So there is another question in the chat, that is this scheme applicable for government health facilities? So yes, this scheme is applicable for both private and government health facilities. One question